Trigger points as a cause of tinnitus. Well, the first thing I want to share is just a brief history of how we came to understand that trigger points can cause tinnitus. We've known for a long time that toxins that build up in muscles can irritate the nerves of that muscle, sending irritating signals into the nervous system. And Janet Travell, a medical doctor, did much of the pioneering research in this field during and after her success in treating President John F. Kennedy for his chronic lower back pain. All the way back in 1942, she explained how these trigger points, which are toxins built up in muscles, could cause widespread nerve irritation, known as myofascial pain syndrome. So at that point we knew pain was part of the picture, but pain is not the only form of nerve irritation these trigger points can cause. In 2012, researcher William Tichy is quoted in the International Tinnitus Journal saying, "Although pain is the best known symptom of this muscle disorder, trigger points are responsible for a large number and a wide variety of symptoms, especially in the head and neck. These symptoms often masquerade as primary disorders of the ear, nose, and throat. And one of these symptoms is tinnitus." Also in 2012, Rocha, another researcher, got serious about determining exactly what muscle could cause tinnitus and how we could tell if someone would be helped by appropriate therapy. So what he did before the treatment, in the people who had tinnitus, he evaluated with his hands all the muscles that could be causing the tinnitus nerve irritation, the 8 muscles. And he asked the people in this evaluation how it affected their tinnitus when he was working on them. Did it make it temporarily louder, quieter? Did it cause there to be fewer or more tones that they heard? And then the treatment. He had one group of people that he did weekly, 10 sessions done weekly on these specific 8 muscles. He did manual muscle therapy, included trigger point therapy and myofascial release, and he gave home exercises and habit changes such as applying heat locally, stretching, and postural instructions. Alright, so that was 10 weeks. So after the treatment, the people were asked how their tinnitus had changed. The results were best in a subgroup in which the tinnitus got quieter before treatment, in the before treatment evaluation. So after 5 treatments, improvement was seen in pain, tinnitus intensity, number of sounds, and the total tinnitus handicap inventory scores, the THI. After the 10th treatment, some tinnitus frequency in the people moved from constant tinnitus to intermittent. Others moved from intermittent tinnitus to absent. They didn't have it anymore. And then at a 2-month follow-up, 2 months after their 10th treatment, 76% of this subgroup showed stable scores, meaning their symptoms hadn't regressed to where they were at the beginning. So that's pretty exciting. So it's really nice to know if you're part of the subgroup, but even if you're not, it still may be helpful. But if you are, then it looks really good. So if you have tinnitus, myofascial trigger points may be all or part of the cause. Since only a few people were able to see me personally, I developed a self-evaluation technique. Follow this technique carefully to find out if myofascial trigger points are causing your tinnitus. The 8 muscles that we're going to evaluate, you want to start on the right side, but you should also, of course, repeat it on the left side. You might also find that looking in a mirror is very helpful in following these directions. If you choose, having a professional trained in muscle therapy follow these directions on you would be even better. But the following technique is designed to be done without the help of a professional. So some professionals that might be particularly good at this are chiropractors, good massage therapists, and good physical therapists. Dr. Tichy in the International Tinnitus Journal in 2012 said of trigger point therapy that the only certain way to determine whether trigger point treatment will be a benefit for you, and benefit for tinnitus in particular, is to carry out a therapeutic trial. So try it out. Before finding the critical muscles and trigger points within a muscle, you need to know how to use your hands in a way that brings the problem to the surface. Without the proper technique, it's entirely possible to go to the exact spot that is ground zero of your tinnitus cause and miss it. So let's go over the 2 simple techniques that you'll use to locate and draw out the toxins from the trigger point. Before finding critical muscles and trigger point within the muscle, you need to know how to use your hands in a way that brings the problem to the surface. Without the proper technique, it's entirely possible to go to the exact spot, ground zero of your tinnitus cause, and miss it. Let's go over 2 simple techniques you'll use to locate and draw out the toxins from the trigger point. So first there's the two-finger method. It's the most common method. With the pad of your fingertip, press moderately deep into the muscle. So I encourage you to move your finger around, feeling the muscle striations. So you'll be in one spot, pressing for about 5 seconds. That's plenty. Doesn't always take that long though. Use the pressure it would take to press well into the muscle tissue. And this is the amount of pressure it'll take to make a depression in molding clay. I prefer to use my index finger with my longest finger resting behind half of the index fingernail for support, so I don't put too much stress on the finger and the joints. Then there's the pincher method. The pincher method is used for muscles you can reach around, like the sternocleidomastoid. Using your thumb and finger, reach around and squeeze the muscle, moving slowly across and along the muscle band, looking for hypersensitive areas. Use the pressure it would take to gradually flatten a ball of molding clay. So just gradual. It didn't have to be really hard, just a gradual pressure that would gradually flatten this clay. Or you'll use the same techniques to correct trigger points later. If you're very toxic, it may be too painful to apply the full pressure until you've done the treatment for a few sessions. Now let's look at this again as you practice on the masseter and the sternocleidomastoid muscles. So for the masseter, so you try this now. Use your index finger, back it up with another finger. The way you find the masseter is right here, right in front of your ear. Press in there. We'll go through this more carefully in a minute, but get some practice. So press into that muscle, you'll feel hard bone behind it. Press in, feel the different striations. Go fairly deep if it doesn't hurt too much. Spending a few seconds in one area, you might slide the skin around, but you're on one spot of the skin, feeling different areas of the muscle underneath. The next is the pincher method. This is particularly good for the sternocleidomastoid. So use your thumb and your index finger. So you can do it like this. I tend to grab in like this, so I'm using my finger sideways instead of just straight. Reach in, grab the muscle, and give it a little squeeze. Move one or the other fingers as you're feeling for a part of the muscle that is tender, and part of the muscle that causes an increase, decrease, or a change in any way of your tinnitus or headache or TMJ problems. So now let's get started. The masseter on the right hand side. So lay your fingers flat on the side of your jawbone in front of your ear. Clench and relax your teeth and jaw. And feel the muscle bulge and relax under your fingers. The insertion or belly of the muscle. So with your right hand, locate the lowest portion of your jawbone, your mandible, from the back angle to about 1.5 inches along the bottom. Press in here, checking for trigger points. So when you found a trigger point, it'll be a very tender area. That's important. But even more important is if it causes a change in your tinnitus, causing it to increase, decrease, or changes the number or type of tone that you hear. So move up slightly and check again between this front border where it drops off into your cheek and the back border where your jawbone meets your ear, or where it drops off below your ear. Repeat this until you've moved all the way up to the bony ridge called the zygomatic arch. So we drop off the front, and we go back, Now we're up to that bony ridge. We're going to feel along the bottom of that. Okay, then we're starting at the back part of the bony ridge between your ear canal and your eye. So the bony ridge goes from here up to here. We're going to go to the bottom portion of that. So starting back here, press in just below and up against it, checking for trigger points as you work your way forward. So as you get forward, as you go along, you're almost at the front, it drops down just a little bit into this area we call the cheekbone. And this arch is the origin of the masseter muscle. This is zygomatic arch. Now the temporalis muscle. Just as we did with your right hand on the masseter, locate the bony ridge called the zygomatic arch between the eye socket and the ear canal. Starting at the front part, press in just below the ridge where it angles down to form the lowest part of your cheekbone. Press into the soft depression. If you're too far back, you'll notice there's not a soft depression. You can't go in far. Here you can go in very far. Then backwards against the jawbone. So you press in and backwards. Continue pressing backwards gently as you carefully open your jaw to expose more of the insertion of the temporalis muscle and the cheek for your trigger point, and check for trigger points here. Very good. Now let's lay your fingers flat on the side of your jawbone in front of your ear, then move your hand up till your thumb is over the center of your ear canal, and your fingers are flat on the side of your skull. Then clench and relax your teeth and jaw and feel the muscle bulge under your fingers. Just as we did with the masseter, you'll be able to feel the masseter here underneath your palm, but you'll also feel the temporalis underneath your fingers. So the muscle attaches to this entire area here under your fingers and goes all the way back to here and then comes down underneath the zygomatic arch to attach here. So we're going to check this area for trigger points in that area of the muscle. So begin checking for trigger points where the tip of your little finger is, right here. So behind and above your eye. And you work backward, pressing in, moving the skin around to feel inside the muscle or the texture of the muscle and deeper in the muscle. You work back, checking for tender areas and in particular trigger points that cause a change in your tinnitus frequency, loudness, or change in the tone. So then we'll drop down just a little bit. We'll work forward again. So you're going to do strips. Here, 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 here. And then you work all the way down until you're right on top of the zygomatic, or just above the zygomatic arch. Pressing in, checking for trigger points. Okay, levator scapula. Origin, the top end of this muscle is found by feeling just behind and below the ear for the large knob called the mastoid process. Then you move slightly below the lower tip. So find the tip, move slightly below, and then move back around your neck 2 to 3 centimeters, about an inch. Okay, only until you have something harder than muscle to push forward against. So as you push forward, so not to the side, but as you push forward, go from the tip, push forward, forward, soft, soft, soft. Push in there pretty deep, like we were before, and then you feel something hard. This is the C1, the top vertebra. And start checking here with the press method. Okay, pushing forward, perhaps a little bit toward the midline, but mostly forward. Then move down about 1 centimeter. So in this case, I like to support my middle finger here with my index finger like this. So I'll use one finger so you can see it easily. So move down about 1 centimeter and press forward again, feeling for trigger points. Move down 1 centimeter again and check this 2 more times. Do that. Down again. Okay. So that's the origin of the levator scapula. Now the insertion, the other end of this muscle, is found by reaching your left hand around in front of the opposite shoulder. So you may want to take your hand and push your elbow up with this so you can get back there more easily. So reach around, cradle under your elbow as you reach back over and touch the spine of the scapula. The spine of the scapula is here. Okay, so you feel along the ridge toward the spine of your body, the spine being back here. Okay, and this is the spine of the scapula. So you feel along there till you find the vertical edge of this bone of your scapula. So the vertical edge is here. So you moved along the spine. It kind of fades away, but if you're pushing it hard enough, you'll feel that vertical edge there. So it oriented this way. So this spine meets this edge, and you press deeply into this. This is the origin of the levator scapula, here along the edge of the spine of your scapula. Okay, and you move up just a little bit. It's along this edge. So you have to press in and then press laterally. It's fairly challenging. So we moved along the spine, we drop to the end, and then we move up, pressing laterally against this. That's the levator scapula insertion. Check for trigger points here. So this insertion point is only about 1 inch long and just above the spine of the scapula along the medial, the inside edge of the spine of the scapula. The upper trapezius. Shrug your shoulders. Notice the prominent muscle that lifts your shoulders up to your neck and skull. This is the upper trapezius. The origin of this muscle is the attachment to the skull. Evaluate using the press method. The origin of this muscle is found by feeling along the back of your skull until you get to the very midline. Moving down until your fingers drop into a depression, so just off your skull. And then press up and in toward your skull as you move your fingers to the right side 2 to 3 centimeters. So you can do this with one hand or 2 hands. Maybe easier to do with 2. So you've gone the right to the very center, and then we press, drop down till we feel a little depression. It's very small because you have another vertebra here at the beginning, so the depression is just about the size of your finger. You can get it in there and then press in and then up, and then check for trigger points there. Move over just a touch, press in and up. It's a very common error if people have trigger points. In and up. Now if your neck's stretched like this, you may not feel it, so you want to be sitting up straight. And so you move over little by little until you've gone 2 to 3 centimeters, about 1 inch. Work checking that whole region between the midline and 1 inch over. Okay? Then from this, that's one of the origins of the muscle, very critical area. From this off-center point of your lower skull, move your fingers down about 2 to 3 centimeters, about 1 inch. So now we're on the spine. Press in toward the front of your body deep enough so that you're able to press from left to right. Now if you're too close to the center, you won't be able to press in at all. You're right on those bony spinous processes. So you'll need to be off to the side about 1 inch. Press in. And then you should be able to go from left to right, pressing directly this way. You're pressing up against the side of the spinous process of your vertebrae of your neck, up against this attachment site. Okay, so you evaluate using the press method here. Continue evaluating all the way down your neck. So pressing to the side. all the way down your neck. Feeling for those trigger points. See if it causes any increase in your tinnitus, increase in headache. So you got to the very bottom. And you might find it easier using your other hand, pulling across this way. Whatever works best for you. Okay, so we worked all the way down. To find the insertion point of this muscle, the other end of the muscle is found by reaching your left hand onto your right clavicle, the collarbone. Wrapping your fingers over it, pressing down into the depression on the other side. Move your fingers toward your shoulder until the bone rises a bit, and then it runs into another bone over your shoulder. So you're going to press in here, these last few inches, press in, pull forward, and palpate in there for tender points, or those especially that increase your tinnitus or your headache. Then you continue evaluating as you move around the bend. So you're going in, and then you'll start to press out. These bones form a corner here, a rounded corner. So you're going to be pressing in and forward, in and sideways, down and backwards. Okay? You may start to use your thumb out here as you push in and then pull toward the side. Okay? And then you'll move up over the muscle here. So it curves around. And now we're back on the spine of the scapula here. You'll press down, and you should feel a bone that you can press that way against. That's the spine of your scapula. Move around just a little bit, feeling for those trigger points. All the way to the end of the spine of the scapula, where the scapula ends over here. Okay, finally the belly of the muscle. Starting out near your shoulder, use the pincher method to evaluate the upper trapezius muscle. So relax your shoulder, don't let it be lifted up. Let it relax. Reach in, squeeze the muscle, feel different parts of it. Not just right where you can squeeze, but feel the edge of it. Grab a bigger piece and feel deeper down. Evaluate all the way up till you get close to your neck here. It's a much thinner muscle here. Because down here you're grabbing two parts of it. You're grabbing the part that attaches here and here. It's almost like a tube here. Okay. Splenius capitis. So the origin of this muscle, we start just as we did with the levator scapula. The top end of this muscle is found by feeling just behind and below the ear for the large knob called the mastoid process. This muscle attaches to the back of the mastoid process. It also attaches to about 2 inches of the skull, moving back and slightly up from the mastoid process around the back of the skull. About 2 inches here. You will press toward the front and a little upward as you check for trigger points. So let's start behind the mastoid process. Pressing forward against that. Feeling for trigger points. And then we start to move up onto the skull, more toward the midline. So we press in and up. But it's also doesn't have to be just in and up. It can be actually up on the skull here for this one. So we press toward the front and a little upwards as we check for trigger points. Okay, for the belly of this muscle, we note that it attaches here, and then it moves down toward the bottom of the neck and the top of the upper back, attaching to the side of the spinous processes. So this is the muscle. So we can start up here. You can use a couple fingers, or one finger, or 3 fingers here. So we check for trigger points as we move down and toward the midline of the very bottom of your neck. And a few inches of the upper back. So once we get down here, we want to be pretty close to the spine. Now the insertion of this muscle on the lower part of your neck and about 1 inch off the midline, we're going to press in toward the front, and then from right to left, either push or pull to the side up against the spinous process. The spinous process is the pointiest part of your spinal bone on the back. So this is where the splenius capitis inserts to the neck and the upper back. Okay, that's the end of that one. Sternocleidomastoid. The origin. With your right hand, start at the very top of your sternum bone, down here. This is the muscle here. We're going to start down here. Start with your right hand at the top of your sternal bone. So just below your neck, just to the right of center. And turn your head to the left to cause this muscle to protrude. Use the press method to check for trigger points at its attachment to the sternum. You might also check its attachment over here on the clavicle. See if you find trigger points. Then use the pincher method to evaluate the belly of this muscle as you gradually move up this band of muscle. You may want to bend your head forward to relax the muscle and continue to have it rotated to the left a little bit. To have the muscle fully relaxed, and it goes from here to here. Some people end up moving too far around the back. If you're not sure where it is, turn, have it stick out again, reach in and grab it, and then relax. So as you move up toward the mastoid process, the bone just below your ear, you'll need to tilt your head slightly forward to allow access to reach around this muscle. But you don't want to flex and turn so hard that it's hard to press into the muscle. You want the muscle to be relaxed. So to show you with the other hand, this top area is the most difficult to get relaxed and work on at the same time. Then as you get to the mastoid process, feel the tip of it down here. You can work a little bit to the front on the tip and around the back just a bit, and even up on the skull, feeling for trigger points.